So the last thing I want to just quickly chat about is some advanced feedback techniques. Don't worry, it's not going to take very long. This is the kind of thing one will go and look up in much more detail. Obviously, this is the kind of thing one trains over time. But just to give you a bit of an idea, what does it look like in practice if we are actually providing feedback to somebody else? The first technique I want to talk about is appreciative inquiry. They actually teach this to our DCSTs. It's within the DOH as an ideal of how we need to be communicating. That's a great book about it. And the idea is that when we talk, when we string sentences together in a conversation, when we say something, it can either be appreciative, right, building up, or it can be depreciative, be negative or taking away. And we can either ask a question, right, or we can be making a statement. So this is going to give us a nice graph. We like 2x2 tables, don't we? So I'm just going to show you what the combinations look like. So a destructive conversation will be a conversation which is depreciative and where you're asking questions. It's those kind of questions where there's actually no answer to. It's like, what are you doing? Are you trying to kill this patient? You know, that is a very destructive conversation. You can't say anything back to that. It's like the which kind of university did you go to kind of a thing. Those conversations are extraordinarily damaging. And this is where real toxic environments come from. Critical conversations doesn't have the inquiry. It's not as bad, but it's also almost never helpful. Critical conversations might be useful in a safety issue. Like, don't do that. Fair enough, you know. But being able to criticizing somebody and saying, you don't know this, or you're not aware of that, or is in itself also not helpful. Affirmative conversations is when we are giving somebody good, just positive feedback. You did this well, I'm happy with that. That's very good. It's already helpful, and it's part of creating affirming environments. But the conversations worth having, the most extraordinary conversations, and this was AI before we had our current AI, I think they're going to have to work on their abbreviation. So appreciative inquiry is about asking questions where you are genuinely interested in what this person knows and how this person can actually add to what is happening. So where do you think we can find more information on this? How do you think we can solve this? What has worked for you in the past? What do you think is, and being able to reframe whatever we want to say more and more towards these directions and more away from these directions. There's a whole skill level on that. So the idea is that if you have generative conversations, if we're having a conversation, asking each other generative, curious, warm questions, that creates really meaningful, rich conversations that are mutually enlivening and solution-focused. And so the simple thing is if you are going to ask somebody a question, and if you are going to, so for example, in a mentoring scenario, you want to know, are we going to generate positive ideas rather than interrogating people? So then I want to just talk a little bit in terms of a tool. And when we are giving feedback, when somebody comes to you with a question, with a case, for example, we want to look at listening before we talk. Always elicit first from the person before you give feedback. We want to always affirm what is well and build on that. And this is not the sandwich method of saying something nice and then say something bad and then say something nice. This is really about using the strengths as already a way, as a building platform in terms of where we want to go future. If there are mistakes, to be gracious about the fact that there was a mistake. Oh gosh, you must have missed that, or maybe you didn't see that, or maybe you didn't hear that. And we want to go away from criticizing and belittling and pointing out all the stuff that's wrong, and rather finding ways to frame it into an appreciative framework. And we want to use each interaction as an opportunity to teach, creating that seek curiosity space. Oh gosh, we can learn something from this, and how can we learn something exciting and new from what's happened? So to finish up, I'm going to just talk you through the 1-minute preceptor. I think most of my medical officers might have seen one of these already. This is basically any scenario where somebody comes and presents a case to you. And the reason why the interns is also important, guys, because you're already in a scenario. By the time you're in ComServe, you're already going to have students and nurses and people who's going to come and discuss patients with you, or you might even have a colleague that will come and ask you something. So the 1-minute preceptor is a tool or a technique that we use when somebody discusses a case. So let's somebody comes to you and they've got a case with somebody who's on ARVs and TB treatment, and they've got abnormal liver functions, and they're thinking it might be a drug-induced liver injury. The first thing I want to know as a clinical supervisor is, well, how much do you know about this topic already? Do you know that they're on new guidelines? What have you read? Have you seen a patient like this before? Because that's going to determine my expectation. and then get them to make a commitment. And I think the important thing is to make people feel safe. Doesn't matter if you get it wrong. What did you think? I just want to see where your thoughts were, and then we can build from there. Then when the patient says, okay, I think we need to do this, figure out why they think that, where that comes from, whether it's right or wrong, it doesn't matter. You want to help them to think it through. By explaining how you think, that actually helps you to learn. And then you really want to build on, you right, that is correct, that is correct, that is correct. And I cannot overemphasize how important it is to tell people what is correct and not just to point out things that are wrong. Then obviously, if there are things that are glaringly wrong, we want to make sure that somebody doesn't go home with the wrong information. And now you want to say, okay, well, actually, this is the new guidelines, so this we now know, we've recently learned this, and be able to build on that. And then it's always very helpful to teach like a general rule. So when I see patients like this, I find these criteria very useful. Or when in our kind of public scenario, sector scenario, this is probably the easiest way to approach this. And then you can send somebody home to go and read a particular guideline or go and look something up that will be helpful to that particular case. Wouldn't it be lovely to learn like this? Okay? And it can be quick. You can literally do this in between 3 and 5 minutes, not quite 1 minute. So in conclusion, to shift paradigms, there's only 2 things we need to know. We need to be kind to ourselves. And that means living from a prefrontal cortex point of view, being able to understand we have these dragons that brings all these troubles, being able to look after and continuously work with our own inner dragons. And that makes it possible to be kind to one another in the ways that we act towards their dragons and in the what we are able to bring to different work scenarios. Sounds very simple. This is the future of where we need to move to as humankind. Because at the moment in society, we are not kind to ourselves. We let the dragons rule, and we are not kind to each other. Thank you very much.
So, we recommend